Hey YouTube, it's Emory and welcome back to another week of my first year on T. So we're back for another week. I'm sorry that I missed last week. I had a lot going on and I actually filmed an entire video early in the week and then so much went on that I never had time to finish it. But basically, I found out that I'm having top surgery in April, and I was working on a bunch of background stuff, getting denied by insurance, and a whole whirlwind of emotion that went on with that. But basically, I'm not gonna get insurance coverage for my top surgery, so I figured it's what better time than now to just book it and pay the payments later, because I can't really hang out without having it anymore. So it's kind of a bittersweet thing, and it means that I'm gonna have to, pay a bunch of money out of pocket. But luckily I got the first 10% of my surgery total covered by my fundraiser, and my fundraiser's still open, so if you are able to donate or anything like that, that would be amazing, so I can actually make payments on time and that sort of thing. But I got that first 10%, which meant I got to put my deposit down for surgery and actually schedule. So I do have a date, and it's April 10th, 2018. So I have about a month and a half before surgery. I think a month and a half, 2 months, something like that, before surgery. But this week on my first year on T, we are talking about binding and packing, which I think is kind of interesting, finding out that I am getting top surgery soon and having a binding and packing topic, because they're kind of interrelated. And for me, I don't pack, which packing is when you put some kind of prosthetic or any kind of small object like a sock or something soft in your underwear to create the appearance of a bulge if you don't have one. And I don't do that. I don't really feel like that's something that I need to do to feel comfortable, so I don't do it. But I do bind, and I'm actually wearing a binder right now. It's a GC2B binder, and I have, I think, 6 of them. And GC2B is an amazing company. They are super nice. You can follow them on Snapchat actually, and they have a lot of cool posts from each person on the team. I'm sorry the sun keeps changing the light. But anyways, they're really nice and really responsive. Their shipments are really quick, especially if you're in the US. I can't speak for outside of the US, but they're really great. And the binders are super comfortable in terms of being as comfortable as you can be for squashing your chest into something that's too small for your body. But I have always used GC2B binders since I started binding. And like I said, I have like 6 of them, and I'm trying to figure out what to do with them in terms of giving them away post-surgery. Since it's happening soon, I'm going to have 6 binders that I don't need. And I'm kind of thinking about giving some of them, like maybe 1 or 2 away on this channel. Maybe binder giveaway, I don't know. But I currently volunteer with an LGBT organization where I live, and I definitely want to donate maybe 4 of them to them, because they have a whole closet for LGBT people where you can come in. If you're, say, a trans guy and you have a bunch of girls' clothes that you don't want to wear, you can donate those and then go into the guys' closet and get guys' clothes, but something closer to your own gender identity. And so then maybe a trans girl who has no girls' clothes can come in and get those clothes. So it's a really nice organization, and so I'm donating those there. But I'm thinking about donating some of my other binders here. They're all size medium. So yeah, I definitely bind with real binders. I've been binding for about a year now. And with like compression, I'm gonna say tops that aren't binders, I was binding forever before that. I think I just didn't really know what binding was, but I always I hadn't worn like a girl's bra in years. Before then I just wore like sports bras or compression type things. Since I don't have much to say on the topic of packing, I'm gonna talk more about my top surgery because I'm really excited about it and it's kind of on the topic. But since I started binding, I feel pretty okay while I'm wearing the binders, unless I'm wearing a newer one that's tighter. I've definitely worn, like the one I'm wearing right now, I went to the gym in this because I've had it for so long that it's so stretched that it's almost like not a binder anymore. It's so stretched out. But if I'm binding with a super tight binder, sometimes it'll hurt or I feel like I can't breathe as well. But with all of my other binders, I feel pretty fine in them all day. But the issue is I'll wear it for, you know, during the day for like 8-10 hours. And then take it off and then wear it the next day and take it off and wear it the next day. And if I have like 2 days off in a row of work or going out or whatever, I won't bind. And the issue comes in when I go to put on my binder on that 3rd day when I'm going back to work or something like that. I always have a problem. And it's really common for me to have rib pain on this right side when that happens, or my back will hurt or my neck will hurt, something like that. For some reason that always happens to me, but that'll be gone soon. So I'm going to not need binders anymore by April 10th. So now is kind of crunch time for when I need to go to the gym and work out and prep my chest for top surgery. So my goal right now is to do 3 days of workouts and then 1 day off, and then 3 days and 1 day off. So I'm kind of giving myself time to build muscle, and I'm alternating which muscle groups I'm using each day so that I'm not overworking one muscle at a time. So I'm trying to work out as much as I can without pushing myself potentially too far and not being able to work out anymore. But I just started like 3 days ago, so I don't have like a whole lot going on right now, but yep, that's my goal. So the reason for that, working out up to top surgery, which I'm sure you can guess, but I definitely want to build pec muscle. It really helps your surgeon to be able to see exactly where the pec lines are, so that they can make your incision along the pec line. And then when you develop more muscle in your chest post-surgery, it'll kind of line up, and then the scars are sometimes a little bit hidden by your pec line, or at least they go along with it so they're not as noticeable, and that's a goal for me. I don't mind the scars in general. I think they're kind of cool. I definitely want pec muscle and then have scars kind of hidden by it. That's my goal chest. So I'm going and I'm working out my chest and shoulders mainly because I feel like having this area built up will be really good. But I'm also working out my lats, which are these side muscles here, as kind of like a tertiary point of focus for my workouts. And then I'm doing cardio. But another thing that's a goal for me about working out is to work out the entire rest of my body, because I think it's going to be important to have overall strength in the recovery process. Just because I know that even if you're kind of hunched over and protecting your chest and all these muscles kind of feel like crap, if your legs are stronger and your back is stronger and stuff like that, I feel like it'll be easier to get myself up and get around and feel stronger while I'm kind of nursing these other muscles when they're in need. I don't know if that logic is right or what, but I just want to gain overall strength, so I feel like I'm healing quicker and I can get back to my normal everyday things. So I guess I'll kind of update you guys briefly in each video from this point on, just to kind of tell you about my progress, and I might put in, I don't know, update photos of where my workout progress is going, muscles and stuff like that in the future. But that's all I have for you guys this week. I will see you next week on my first year on T.